Hello, this is Dr. Shemen. We're going to discuss salivary gland issues involving the parotid gland. Once again, there are 6 major salivary glands and several hundred minor salivary glands. We're discussing the parotid gland, which is situated in front and below your ear. Now, the parotid, like the other salivary glands, produces saliva. The parotid gland can be affected by benign conditions such as infection or inflammation, and typically the parotid can enlarge if one has not been drinking enough fluids. Dehydration will cause the gland to get swollen and painful, and typically that pain runs in front of the ear, towards the eye, and even the ear. Many of these patients can be treated with antibiotics and simple rehydration. Uncommonly, you can develop a stone in the duct. It's called Stenson's duct, and that runs from the parotid to opposite your second upper molar. There's a small hole there, and that's where the saliva from the parotid gland drains. What we can do in an office procedure is, through the mouth, go in and open up that duct that conveys the saliva. If there is a stone, we can remove the stone. If the Stenson's duct, the conveyance of that saliva, is too narrow, we can stretch it open. Once again, that is an office procedure. Other issues that involve the parotid gland are benign and malignant tumors. Most parotid gland tumors are benign, and these are treated with surgery. Malignant tumors are also treated with surgery and may, if necessary, be followed with radiation. Now, let's discuss parotid gland surgery. This is the parotid gland over here, as you can see, and there is a nerve that it is situated on called the facial nerve. The facial nerve exits the skull under the ear and then pierces and runs through the parotid gland, supplying the eye, the upper face, and the lower face with movement. So it's very important doing parotid gland surgery to preserve that nerve function. Now, for many years, we relied only on visual inspection in order to preserve that nerve. We wear what's called loupes, which are like telescopes attached to glasses, and we're able to magnify the operating field in order to see and preserve that nerve. This day and age, what we use is intraoperative nerve monitoring, by which we put electrodes near the eye and near the lips, and that is then connected to a computer. Once we're near the nerve during the course of the procedure, the computer will alert us when we're near the nerve before we can actually see it with our eyes. And by that means, we can preserve that nerve function. As I mentioned, if the gland is involved with a benign tumor, removing the tumor itself along with a cuff of normal parotid tissue is sufficient. On the other hand, if it is malignant, it will require not only the removal of the parotid gland, but also the lymph nodes in the neck, and that is done at the same time. Most patients undergoing parotid gland surgery can be discharged the same day. Some may stay overnight. Those undergoing resections of malignant tumors will likely stay one night and perhaps an additional day. If you have a parotid gland issue, please feel free to call us at 212-472-8882. Thank you for your attention.